Thank you for joining us today. When a child's legs do not appear straight when standing up, we call it an angular deformity. This can be described as either bowlegs or knock knees. This video will discuss Genu Varum, or bowlegs, and how we treat this condition in children. In most cases, when a child's legs appear bowed, the legs are actually completely normal for the child's age, and they will gradually straighten out with time. When they first begin to stand, most children will appear to be bow-legged. Some children appear more so than others. Most of the time, this is due to a natural turning in of the leg bones called tibial torsion. If you disregard the position of the feet, the legs at the knees will appear straight. We call this the cover-up test. This is the same patient from the previous picture, showing the knee is actually a little knock-shaped, normal for this age. Because of this twisting, children change the way they walk to prevent tripping. They rotate their legs outward, which causes the knees to bend slightly, giving the appearance of bowing. When children stand with their kneecaps forward, the legs will appear straight, and the feet will turn inward. By 2 years of age, most children's legs will appear straight with standing, and any remaining twisting will resolve by 4. The normal growth pattern then continues, and the legs will appear to knock together, also known as knock-kneed, by 3 to 4 years of age. Finally, the legs return to a straight alignment again by age 7 or 8. This graph represents the normal expected alignment of a child's legs over time. If both of a child's legs appear the same and follow the pattern described, we usually do not get concerned as they are normal growth changes, or what we call physiologic. If angular deformity persists beyond the proper ages, or if one leg is angled more than the other, then we become more concerned for problems that could persist and lead to deformity and pain in the future. Evaluation for any angular deformity begins with a physical examination and x-rays, the most common being an x-ray from the hips to the knees called a standing limb alignment. To assess the limb alignment, a line from the center of the hip to the ankle will be drawn. After age 8, this line should go through the middle of the knee joint. There are multiple things that can cause problematic bowlegs, or Genu Varum. One example is called rickets. Rickets can occur through a variety of ways. If children do not receive enough vitamin D and calcium in their diets, such as when breastfed solely after 6 months of age, they can develop dietary rickets. Foods such as vitamin D milk, salmon, spinach, and kale are great sources of both calcium and vitamin D. Dietary rickets will usually resolve once treated with proper vitamin D and calcium supplementation. Rickets can also be familial or genetic. Often this will be known ahead of time because other family members will have something similar. Pediatric orthopedists will work with a pediatric endocrinologist to determine the cause of the rickets. If caught early, the condition can be treated medically without surgical intervention. Another common cause of bowlegs is Blount's disease. This occurs when the upper growth plate of the shin bone, or tibia, does not grow properly and causes a sharp angle just below the knees. This can affect a single leg or both legs. In Blount's disease, the growth plate is called a symphysis and has a distinct appearance in x-rays. You can see on this patient how the upper tibia looks like a ski slope. If a child is younger than 8 years old, we call it infantile Blount's, and if older than 8, adolescent Blount's. This is important to distinguish because infantile Blount's disease may require more than one surgery over time to correct by the time a child is fully grown. Blount's is often seen in children and adolescents who are overweight and can cause pain in the knees as a patient ages. Treatment for Blount's is often surgical, but if a child is young, less than 4, bracing can be attempted. Surgery usually requires osteotomies or bone cuts, but in some instances, a procedure called guided growth can be used, sometimes in combination, as seen in the middle picture. Here's a patient long-term postoperative showing normal alignment. The guided growth technique uses small plates and screws and a child's own growth potential to slowly straighten out the deformity. It requires routine and frequent follow-up and often requires a second surgery to remove the plates once full correction occurs. This technique is a very powerful tool that does not require cutting bones and can be repeated if needed if the growth plates are open. It is important to follow up as directed by your surgeon if this procedure is performed, because x-rays show when it is time to remove them. If follow-up does not occur, overcorrection can occur, requiring the same procedure to correct it. In adolescent Blount's, guided growth is often used, but bone cuts may be required if a child has finished growing. Most angular deformities of the legs in children are painless, will spontaneously correct without any treatment, and will not cause any long-term problems. In more serious cases, we can usually use less invasive procedures to correct the legs if caught early. Therefore, it is very important to follow up with your pediatric orthopedic surgeon as instructed. Thank you.